and the 223,820 on the trash, those are the two things that the general public have the most interest in. You know, while the other things are important to us, some of it we can address in October, and some of it we're just going to have to take our lumps and bite the bullet on, as we would if the override failed. So again, I'd ask the board's consideration on the either one of the two matters.
I'm going to ask the board on the first proposal that you made. Is it clear what Steve is attempting to do here?
Very clear.
Okay. Basically he's saying we're going to take out the amount of money, which is the savings, with a $10 copay and $50 emergency room pay. Going from 5 to 10 and 25 to 50. Estimated savings around $200,000.
And a mail-in prescription.
The mail-in prescription from 90 days to 45 days. And in the process, provide those savings to the school budget with the understanding that, in fact, if successful in the negotiation, then 2/3 of that money is for the school side. 2/3 of the money that they got is not available.
Right.
And on the town side, the 1/3 is results in cuts in.
My suggestion is just cut the salary pool and let the administrator deal with it.
Right.
For the positions.
Can I speak?
Yes, I just want to make sure it was clear.
I think that's
exclusive, excuse me, Joe,
Yeah,
exclusive of the issue of how you go about reserving the money, which will have to be worked out.
I think that would probably be one of the most unfair things this board could ever do to the employees of this town. I don't see how this board can spend money it does not have, hoping they get it on a threat that if they do not increase their co-pays, there's going to be layoffs and cuts in budgets. I would never agree to that if I was hanging from a cliff by my toenails. That is absurd to do that, to threaten the employees that if they do not pass this, that there's going to be layoffs and cuts in budgets. I definitely will not agree with that first scenario, and I'll even answer on the second one. I know we agree on a lot of things on that second one, Steve. I'm not going to cut that either, because I don't think the cost of the override is what's going to make it or break it. I mean, it's under the million figure where a lot of people wanted it, and I really think we should put back some of general government, rather than saying we're just going to hold it off till October or whenever we have some free money. Respectfully, Steve, I couldn't disagree more than I do with both of your proposals. I can't do it.
You looking for me to say something?
Well,
Sure.
you look like you were going to say something.
No, I'm being patient, being patient. I really agree. I agree with what Mr. Vino said about spending money we don't have. To me, I think negotiating lower copay is a great idea, but I don't understand why we wouldn't negotiate it, okay, first, then make the adjustment. And if we need to have, if we need to adjust the budget after we negotiate, if you think we can negotiate this between now and July, which is really pretty good negotiating, but if you think we can do it, I say do it, and then we'll pick up that money afterwards. I mean, absolutely. But I think to spend money that we don't have is just, I can't see it. I just can't see it. And as far as the other thing is concerned, I'm against an override, and I'm against the override. You refer to political reasons. It's not political reasons. It's what I feel is the appropriate thing. If you think we're going to be short next year, asking people for an override 2 years in a row is not a good thing. It's not likely to happen 2 years in a row. Is it likely to happen this year? Well, that isn't even the issue. The issue is, what do you think is going to happen next year, and why should you ask for 2 years in a row? But that being said, if you go, my view of it is, if you go for an override, you give people the opportunity to restore what's been cut, including rec, big cuts to rec. Rec ought to get a chance to be restored, and other items. I'm not in favor of doing it. If you're going to do it, I think you say to people, here's what we cut. What do you want to do? You're the one saying we should give people a choice. If you're going to give them a choice, give them a choice. So that's my feeling of the two issues.
I think the first proposal is in somewhat of bad faith. I don't think it would put us in very good favor with the unions at all. It's just, I don't know. I'm sorry, Steve, I completely disagree. Well, just politeness. But, I don't know, I just don't think it would put us in very good faith with the unions, and I don't know, I just can't see doing that to people. And, on the second one, I don't know, everybody knows kind of a small government guy, and this kind of goes against what I always say, but I say we should go for the override because it'll give us a chance to restore this stuff, and I think we've done our job. I look at the budget we've put together as a contingency budget if the override fails. I have no problem putting my political rear end on the line every year asking for an override if we have to. It doesn't bother me. That's why I decided to run, because you have to make those kind of decisions, and you get people talking about you all the time, and I don't really care. I don't know, but that's where I stand at the moment. You've been listening to the discussion tonight. I say go with what we have on this sheet right here, and that will be the end of it for me.
I'm going to comment. I like Steve's proposal, and I like it for the following reason, and that is that if we look back over the past couple of years, and we've struggled to balance the budget, and as a result, last year it was balanced on the backs of our school children, which was wrong. Going forward, the same thing. Now, we can predict a shortfall based on our spending habits and what we're doing. And the only way we're going to ever get out from under this is to make adjustments to the way we operate. Now, our health insurance benefits, 70% paid by the town, 30% by the employees. When we propose a savings in health insurance, 70% the town saves, the employees save 30%. It's not like we're taking something from them directly. The $5 to $10 copay and the $25 to $50 emergency are still well below what public sector employees are expected to pay for the health care. This is a necessary adjustment, absolutely a necessary adjustment. And one way to provide some leverage is to put it on the line and saying, we as a board are serious about making this change. It sends a message. And if we can't afford it because we can't affect the change, then we are going to have to make adjustments in services. Or we're going to have to find some significant efficiencies in the way we're doing things. We also have to look for new sources of revenue, but we all know that those new sources of revenue are not going to happen this year. I proposed to the board a week ago that we put together a planning team to deal with looking for new sources of revenue, something that we need to do over the next couple of years. We also need to look at making systemic changes in the way we're operating. And I think this is an opportune time. Tight money, tight economy. It's a good time to start to share the responsibility of making the necessary reductions across the board. So it's not all carried on the backs of the school children. So I think it's a good suggestion. And I don't look at it quite the way you do, Joe.
Yeah,
I suspect, based on what I heard, that it's not going to move very far.
It's important to note. Yeah, it's important to note that this particular change that's being suggested actually results in a 2.5% decrease in premium costs for the town and the employees. It saves the town $200,000. It saves the employees $85,000. It only doesn't change their benefits package at all or their coverage, other than to the extent that they have to put up a $10 copay instead of a $5 copay, and a an additional $25 to go to the emergency room. You know, and they have to send away for some prescriptions that's gonna save them money too, in the long run. Just the nuisance factor of having to send away as opposed to running down to CVS, I suppose, but there's a cost savings across the board for everybody. The taxpayers of the town of North Reading, to the tune of $200,000, which we can then transfer over to the school department, which has taken an inordinate hit, which we all agree upon over the last few years. So we can realize the benefit to those savings immediately, and the employees are going to realize an $85,000 savings themselves. So it's not as though I'm doing anything to suggest that we hurt the employees. I don't see this as being a hurt situation at all. It's about time. I mean, I think my copay went from $5 to $10 probably 10 years ago. And I work for state government, and we don't move around that quickly either. We were slow coming around. In private industry, it was much longer than that. It was probably 12 years ago. So the employees have been enjoying a pretty good benefit for a number of years, and for a short increase in the increment in what they pay for a copay, there's a huge benefit here, and that goes forward. And again, as we go forward and talk about joining the GIC, and as we saw, you know, what's really ironic here too is that Greg, I don't remember, what was the number over the last 5 years we spent in additional insurance premiums, health insurance premiums, $3 million or something like that? $2.5 million?
Without going with the GIC?
Yeah.
It was about $1 million over 5 years.
Yeah.
Just by simply going with the town's plan as it exists today.
But what's interesting is that the GIC this year, we just got the report last a week and a half ago, went up an average of 6.4%. Now that we've got this competition going on, which is a great thing, you know, Blue Cross Blue Shield has said, oh, how about a 2.5% increase? Whereas over the years, we've been talking about 12 and 15% increases, or 11 to
18
15.
too.
Pardon me?
I think we had an 18 too.
Yeah, we had an 18 also, you know, so that municipalities and people in general have been gouged by these companies for years. And now that there's some competition out there, we're finally recognizing some and realizing some of the benefits of that. But basically what they've done to the communities is criminal. And I think it's important that we recognize that, and that this isn't going to last forever. Competition is a good thing, and who knows, we may not switch to GIC. Maybe the plan that Blue Cross Blue Shield puts forward for consideration in order to compete and keep these municipalities will be a good deal for everybody. I hope so. But in the meantime, let's realize the savings now, put it where it belongs. The money is here. It doesn't effectuate, doesn't really adversely impact the town employees at all. And again, if you're worried about not having an override, this gets us halfway to where we need to be for school funding. So I just think it's some consideration. We should probably be doing it anyway. My estimation, we should be doing this anyway. This is what I said before. We haven't gone far enough. We should have been doing this anyway. You know, so.
Michael?
I agree with you, Steve. I think it's a great idea to move forward with this. I just don't think it's good fiscal policy to spend money that we don't have. I agree with you. It's that everybody's going to save money on it, but we don't have that money yet. And seeing what I've seen in the last 2 years, dealing with unions and different government employees, you never know what's going to happen. So I think it's a great idea to move forward with it, and I think if we get an override, we take the money that we've saved, that we will be saving from doing these negotiations, and we put it in a reserve account, or we put it in the reserve account or free cash or somewhere, and that's just more money we're going to have next year and less taxes we're going to have to raise. So I don't know, I can't see doing that now. It just kind of rubs me the wrong way, spending money that we don't have yet.
Again, I'm generally in accord, but again, I've been sitting here a long time, and it takes a significant amount of action and outside influences to force some changes. And again, I've been a party to it for a number of years, and probably a guilty party, in not being able to properly effectuate some changes in the way that we do business. I'm willing to take the risk on the general government side of $67,000 to help effectuate this change and put the money where it really is needed in the upcoming fiscal year. It does two things. It effectuates some change in the way we're doing business and frees up some money for the upcoming fiscal year for the school department budget if the majority of the board